tightly before you start to work this drain and try to work out any clotting that's taking place in this drain. So what I do is I use Purell, or any type of hand sanitizer works. I like it because it's antibacterial. I wet my fingers on this hand with the Purell so it gives me something slippery to work with. So while I am, again, squeezing pretty much like to the point that my hand is shaking right now, that's how important it is that I don't let this go. I'm gonna hold with one hand and I'm gonna pull and strip that drain. Now, as I get to this point, you see I'm squeezing and I'm pinching. I'm gonna work my way up and I'm gonna hold here again, making sure that there is never any tension felt on this incision line. The reason why this is so important is that it's just a tiny little stitch. And if I were to put any unnecessary pressure on this, I could very easily break that stitch and pull out and dislodge this entire drain, which would cause no escape for all of this fluid that is accumulating inside the abdomen. What would happen next? The patient would most likely need to go back to her doctor or her PCP, and he would have to manually extract all this fluid with a needle, which is not fun, it doesn't feel good, and it's very time consuming. We could go on and on. Just remember, do not let go when you're trying to milk this drain. So I'm gonna continue to milk the drain all the way down, redirecting all the fluid or any clots through this line. Pulling, pulling, pulling. Sometimes you'll get little hard spots. That's okay. You just make sure you're anchoring with this hand and you're working through that clot with the other. Continue to pull and kind of strip that line. And as you do that, it's not really showing here because, again, this is just a simulation, but you're gonna notice it's gonna start sucking the fluid. You'll see more fluid coming, and sometimes it'll even make like a straw sound, like somebody's sucking on the straw at the end of their drink. Okay, so now I've redirected everything into my bulb and you see it's full again. So what I'm gonna do, open it up, empty out that fluid, and recap again. Most important, I'm compressing with this hand. So as it starts to expand, there you go. It's taking out more fluid. And that pretty much explains our drains. So it's still draining. So all this fluid will be gone in no time. And that's pretty much why it's so important that you guys know how to properly take care of these drains. I'm glad we could be of assistance, and give us a call with all of your nursing needs.